I thought, what would be better than to use my 34 years in the veterinary industry than to help you guys, the pet owner? What are your questions? What do you need to know? What would you like to know? I want to create a completely interactive podcast where you, the listener, can ask your questions and we will answer them. I will have industry leading professionals come in and have conversations about your very questions. What keeps you up at night? What worries you about your pet? What worries you about the cost of taking care of your animal? There's so many things that we can talk about, but I need you to tell me what we need to come up with. Because if you do that, we can have a great, great, great session.
Hello, everybody. Welcome to another episode of Irreplaceable Tails. I am here with Dr. G and Dr. Sarah. We're going to be answering some of the questions that you guys have sent over to us. Just remember, we are here to educate you guys and help you guys through these situations with your questions and answers, but we are in no way diagnosing your pet. So we have some fun questions that you guys have sent over. You guys ready to dive in?
I am. Welcome, Dr. Sarah.
Thank you.
You're in the hot seat now.
Yeah.
All right, it's time to get going. Let's go.
All right, I have, what's something I might be overlooking in my pet's routine care?
That's a good question. I think nutrition could be one of those things that pet owners don't always pay attention to, or they're paying attention to different fads in the industry.
Right, whether it's like grain-free.
Right, raw, grain-free, those types of things.
And this is the problem. Number one, these foods that have been on the shelves forever have put millions and millions of dollars into research to come up with the right food. Raw food scares the bejesus out of me. I don't know about you, Dr. Sarah.
I've had clients get sick,
Yeah,
go to the hospital because of salmonella, E. coli.
I had a lady come in with 2 Great Dane puppies and 3 kids under the age of 10. And she's like, I'm going raw diet. All 3 ended up in the hospital with salmonella. If you don't believe anything we're saying, just go to the CDC's website and type in raw food diet and pets. And there's some pretty scary things.
Yeah.
Now, the grain-free is scary too, because you can cause a taurine deficiency in animals. And there are actually foods that are recalled. The FDA put out a very striking article about 3 years ago, about the different raw grain-free diets and the breeds, and how many of them were dying of heart disease. Because if you don't have enough taurine, the heart gets very thin, very weak, and can't push the blood around. So it's a form of heart failure from diet. So I agree with you on the diet part. Preventatively, I think people don't realize that the average dog year is 5 years human. And the question I always ask is, when have you gone 5 years without seeing a physician? When have you gone 5 years without getting some sort of routine, simple lab work? You take your kids to the pediatrician. Every single time they go in, they want a urine sample because they're always checking for diabetes. So that's just something to keep in mind. It's just, I wish dogs lived forever. I wish cats lived forever. I wish all these animal companions lived forever because they're incredible. But their lifespan is sped up rapidly.
Yeah.
So even if you go in every year, you're missing 5 years of medical history.
There's so much value in annual lab work, fecal testing, and you can, if you catch something earlier, you can treat it earlier, and the pets are living longer.
Yeah.
Good answers. All right, let's see this one. My pet gets really anxious at the vet. How can I make visits less stressful?
Oh, I love behavior questions. So I'm a fan of medication for pets that are so anxious to come in. I've seen good response with medications like trazodone, like gabapentin. for both dogs and cats. Another thing that I really like is having happy visits. So getting your pet into the clinic, not necessarily doing anything, maybe having them come to the treatment area, giving them treats if they're food motivated, so that every time they come in, it's not this whole thing and they're not getting worked up for it. So trying to desensitize that a little bit.
You came to our clinic and worked, and you saw we're kind of in a prime location where we had a lot of traffic. And we used to tell people, anytime your pet's in the car,
Stop in.
Let us give him treats. Let him, even if you just want to get a quick weight on him, just get him familiar with the clinic, and it's not always a traumatizing experience when they're there.
I agree completely. Better living through chemistry. And now if you're not into that, like there are a lot of clients who are like, oh, I'm not gonna drug my pet to bring him to the vet. Think of a thunder shirt that works well with anxiety. Take them to the dog park and run him or her for 20 miles. There's a lot of things you can do. The food motivation is phenomenal. I have no problem giving out dog treats. I think that's a way of showing love as a human, is food. I think that's a great idea. I think Mallory's idea of stopping by whenever just to get a weight on the dog,
Right.
Just simple things like that, because it's amazing how many animals are afraid of the scale.
Yeah.
What do you guys think about mobile vet care for the pets who are just, I mean, it might not even just be the vet that is terrifying to them, but life, right? Like some dogs just don't do well outside of the house. Do you guys think
I think
mobile
it's a great
vet
option.
care would be a good way
for
to
some
go?
pets, it's a better option for them.
I think it's a great option, especially for indoor cats.
Right.
Oof, because they never leave the house, and all of a sudden when they do, it's like
So traumatic. Yeah.
so traumatic.
Well, they're in a carrier, now they're in a car, then they're in a waiting room, then they're in an exam room, and then you pull them out, and by that point, they're like,
Yeah, and where's the only place an indoor cat ever leaves the house to go to?
the vet.
Or the groomer, right?
Yeah.
The two things, right? So I agree. I think mobile veterinary practices definitely have their place.
Right.
And
You're
I
also limited.
Right.
Right, with
Yeah.
what.
But I think for preventative care, it's amazing.
Okay. What are some fun ways to mentally stimulate my cat?
So I think you have to figure out what your cat likes, like getting just even simple things like the feather toys, toys that are more puzzle-like, where there's like a little mouse, you can stuff it with kibble, so they have and put it around the house, so they have to hunt for it. They even have games on iPads now where they have to like follow things around.
Oh, fun.
And even just a simple cat tree so that they can look outside the window, look at birds, just see different environments.
I think for me, for my cats, I have multiple cats over the years. I love them. Laser pointers have always been a hit. I mean, you should be out exercising, but it's more fun to just sit on the couch for 3 hours and have your cat run everywhere. I love the idea of the hunting. That is something that's still instinctually inside of them. I always try to remind cat owners the only reason your cat's not trying to kill you is because they're not big enough, because they have the same brain as a lion. So, yes, they do want to take over the world. Cats will take over the world one day. They just have to figure out how to use AI first, I guess. There's so many things. Even YouTube has cat TV,
Oh, fun.
which are like they have birds that fly in and out of the screen. They have like a fish tank, just things that they can stare at that stimulate them are all fine. But most of the time, these cats rather sleep. Would just chase the sun around the house and just sleep in the sun, and that's why they gain weight.
Yeah.
So if you as listeners have any video of your cat on a treadmill, would love to see it.
This kind of goes back to our annual exam question. My pet seems fine. Do I really need to bring them in for yearly checkups? I think we already touched on that. Yes, right?
Definitely. We can catch things like heart murmurs. I can't tell you how many ear infections I find, just things that we can do something about. And the pet doesn't always show those signs. So you need a physical exam. You need the hands on the pet for that.
And especially when we're talking about the cost of care, it is cheaper to diagnose something early.
Right.
If you wait and wait and wait, then it gets more and more expensive, because perfect example, teeth, right? If you catch teeth early, and none of the owners ever look at their dog's or cat's mouth correctly.
Yeah.
And we could probably get a veterinary dentist on here to show you exactly how to do that. But if you catch the dental disease early, much cheaper than if you catch it much too late. Because the amount of issues I've seen in animals from bad mouths, forget the breath, forget teeth that have to come out, liver disease, kidney disease, heart disease. I mean, people are like, oh, really? Yes, yes. How often do we go to the dentist for a hygienist? Every 6 months?
Yeah.
Okay, so every 6 months, hygienist. So we already said that
we're brushing and flossing every day, right?
Right.
Which typically our pets are not.
Right, exactly. So 1 year is 5 years. So you're missing, 12. You're missing 12 different appointments. 10 dental appointments. So.
All right. Have you seen cases where a pet's strong bond with their owner helped them recover faster after surgery?
I think so. I'm thinking, does that mean the owner went through surgery or the pet?
If the pet goes through surgery.
I think so. I think the strength of that bond and the comfort level that they have, and this is a familiar person, and this is a voice that they know, a smell that they know. I think it really does help them recover.
In my opinion, I think when they have that stronger bond, they tend to follow the instructions post-surgically better.
Right.
Right? So they'll give the pain medication.
Right.
They will, animals won't show you they're in pain. But trust me, if anyone, if any lady out there has had a hysterectomy, or if anyone's had a ACL repair, they know how painful it is. A broken bone, even a skin biopsy. Those are painful. So use that pain medication. Give the antibiotics till it's gone. We want to avoid resistance. There's reasons for in our madness.
Right.
Most importantly, when they have that strong bond, they will know if the dog's licking the incision.
Yeah. I mean, I always like when you tell owners, oh, there's an ear infection or whatever. Oh, that's great. I still have antibiotics at home. And you're like, wait, what? Why did you not finish giving them the first time?
We already touched on that before, remember?
Yeah. Finish your meds. This kind of is along the same lines. Have you ever had a case where a pet refused to eat or recover until they were reunited with their owner?
Yeah, for sure. I think there's a lot of stress that happens in a vet clinic. It's sounds, it's different smells, it's a traumatic surgery for them. And so we've seen pets who light up when they see their owner. You can really tell.
And I mean, one of the rules we used to have was if your animal eats, we can send it home because we could make sure it's not vomiting. So I would always have the owners come, go outside for sunshine therapy, sit outside on a blanket and bring some white rice and chicken, or if they're allergic to chicken, some ground beef, or, cooked, obviously. And if they eat, that would be great because 100% animals do not tend to eat in the hospital. Unless, of course, you got that crazy lab.
Right.
Or that's such a foodie type dog. They'll eat anything, anywhere, anytime.
Yeah.
But most of the time, the great majority of them, they don't want to be there in the hospital.
Right.
We don't want them there in the hospital. So, yeah, I have no problem with them going home to eat.
Okay. What's the best way to check my pet for lumps and bumps?
So even just when they're sitting next to you on the couch and you're petting them and getting familiar with what you're noticing, and that's the number one thing I see is when owners come to me and say, I just noticed this bump and I was petting my dog, and just being able to get familiar with your pet.
That goes back to the human-animal bond, right? Like my dogs sit on top of me twice a day for their 30-minute massages, and I'm always feeling for lumps and bumps because I'm trained. And my older dude, he's getting some fatty tumors, and I'm just making sure. Yeah.
Oh.
But I'm making sure that they're not growing, they're not getting in the way, they're not painful, they're not firmly attached, they're not changing colors, they're not growing rapidly. Those are all things you need to look at because usually the ones that are slow growing, non-painful, not discolored, not attached, they're usually not that important.
Okay. How can I tell if my pet is dehydrated?
So we look for a couple of things. One thing we look for is skin tent. So on the scruff on the back of their neck, if you're raising that skin, it should really bounce back. And if it doesn't, if it's a little bit more like Play-Doh, and if it takes longer to go down, then that means your pet's clinically dehydrated. If there's also sunken eyes, you're noticing if you lift up their lip and you notice that their gums, we call it tacky. So if it's a little sticky and not as moist, those are simple things that you can tell at home even.
Even the concentration of the urine.
Yeah.
Like you can tell when the dog is peeing orange or dark yellow, that they probably are dehydrated. One of the things I do, and it's just something I do, and I've told my clients to, I always put low sodium chicken broth in their food, just because it makes them drink more salt. Take in salt, so they'll drink more water just to flush their system. I know they're drinking enough that way. It's just something I do. There are animals, and my older guy is guilty of this, that won't eat or drink when the owner's not home.
Yeah.
Right?
He's sensitive.
They just stare out the window wondering where they are.
Yeah.
That's that human-animal bond.
Yeah.
But as soon as you're home, boom. Then they drink all the water in the world. They eat all the food.
Ketchup.
Yeah. So, I mean, the thing is, if you have an animal that's vomiting, having diarrhea, not eating, it's very important to look at the things that you mentioned, Dr. Sarah, the skin tent, the tackiness of the gums, just their urine color, stuff like that.
When is it time to consider surgery for an aging pet versus managing with medication or therapy?
So one of the things that clients always ask is, when I recommend a dental, for example, well, is my pet too old? And I always tell them age is not a disease. And we have to look at your particular pet. Every pet is different. So if this pet has heart disease, kidney disease, liver disease, if there's something going on internally that makes me a little bit more hesitant, or there's an increased risk of anesthesia, maybe we don't decide to do surgery. Maybe in that case, we're medically managing. And also, how is the pet doing with medical management? Is it working, or do we feel like there's something else that we need to do?
Yeah, it also depends. Like, is it an elective procedure, or is it life-saving?
Right.
I mean, if you have life-saving procedure, you have no choice. Elective, everyone's relationship is different with their own animal.
Right.
And it's a decision that needs to be made educated, an educated decision between the veterinarian, the family, and overall what you're willing to do post-operatively as well, right?
Right.
That all comes to play. I mean, obviously, if it's a life-threatening thing, you have no choice,
Right.
right? And I don't even want to talk about the other thing if you don't do surgery, if it's life-threatening. So it's a very hard decision that we face all the time. There's many animals that have been put through surgery where I'm like, I don't know if I would have done that. But if you have a veterinarian that you're confident in, if you have a veterinarian that's confident in their skills, if you have a veterinarian that's like, trust me, I have you, I got your pet, we're going to cover this, and we're going to be in and out of surgery as fast as possible, that's something you might want to look for.
Okay. My pet is losing their hearing and vision. How can I help them adjust?
So it can happen as pets are aging. I try to tell owners to not move furniture and things around the house.
Yeah.
Don't be, redecorating every other week, and pets are having to get used to the new layout. What are other things you can do, like scent markers for them so that they know, okay, my food's always going to be here. Trying to, vibrations or things like that, they can hear more so they're not as startled if you're going up to them. I know that some people use little scent markers that are felt with different
that's
scents on it,
interesting.
and can put in different areas of the house. For blind pets, you can even make a little trail for them to make it
wow.
easier.
Remember, a blind dog's a happy dog, right? A blind cat's a happy cat. For hearing loss, one of the signs that people usually don't realize, but it takes a lot more to get their attention. Like, do they hear you coming in the door? Stuff like that.
They don't hear the doorbell anymore.
Right, exactly.
Yeah.
The one I always get is, my dog's sleeping a lot deeper than he used to. The biggest thing is to remember is, if your dog's losing hearing and vision, shuffle your feet or do something that causes a vibration prior to coming up to them because you will startle them. And
Yeah.
even if it's the sweetest dog in the world, they can nip you because they're scared.
Right.
Yeah.
I had fun story. I had a ferret that ended up going blind, and he knew my house so well. He was fine. He would tear around. But if you left a shoe or something in the middle of the floor that wasn't like typically there, oh my God, he'd be like running full speed and do this like ferret topple over it. So again, not rearranging the furniture, not leaving random things in
And
the middle
along
of the floor.
came Polly reference.
Yes,
Right?
yes. Also, we used to have those clients that would bring in, I believe they're called halos
Yeah.
for the blind dogs. It's almost like a reverse headband that goes in front of you, and it allows the dog to feel if they're bumping into something before they actually
Ram
into it. Yeah. My husband and I fight about this all the time. Do pets have a favorite person in the household? What do you guys think?
I think so.
Yes, absolutely,
Yeah,
right?
I think so.
I mean, it's not me. When my husband's there, it's not me, but I think they do.
And I think it's funny when it's, I feed you and I take you out, and yet you're bonded with this person. I don't understand.
Yeah.
But sometimes there's just a connection that's there.
Yeah.
Well, I personally think it's the one who walks them, feeds them, and takes
Most
them.
of the time.
Yeah,
Yeah.
that's the one they bond to.
Yeah.
But that being said, I've had pets that bond to one of my daughters instead,
Right.
even though they don't do anything for them.
Yeah.
They don't pick up the poop. They don't feed them, but they just are so bonded to them.
Yeah.
I think there's always like, they find their person.
Yeah.
And more breeds are more prone to just bonding with one person
Right.
than other breeds.
Yeah.
Perfect. One example I'm thinking of is like labs love everybody.
Right.
Bernese Mountain Dogs. They're usually one person oriented.
Jack Russell Terriers in general, I think, are typically one person breeds, right?
Right.
Let's see. My older pet is slowing down. How do I know what's normal and what's a health issue? I think this kind of goes back to the preventative stuff we were talking about earlier, right? Doing your labs, doing your yearly routine stuff, and noticing what's normal versus abnormal or what's just age progression, right?
Right. I mean, even preventative exams for seniors, we're doing an orthopedic exam. So if I feel that there's not as much range of motion with the hips, or if I'm noticing something in the exam, I will recommend, hey, let's talk about this. Let's talk about possible osteoarthritis, or let's talk about just doing regular screening so we can get a better idea of what's going on.
And remember, you're going to know your animal a lot better than any veterinarian in the world.
Yeah.
If you think there's a problem,
There's
probably
something going on.
there's something going on.
Yeah, we've talked about this before. Nobody knows your pet better than you, right? Like, use your judgment, right?
Yeah, because we're going to trust your judgment.
Right.
I mean, if someone comes in, and especially, and I know I said this before, especially if it's a mom.
The mom instinct.
Oh
yeah.
my gosh, yes, they're usually right on. Then it becomes like, and you look at this dog, it comes in doing backflips, it's happy. You're like, I really can't find anything, but
Yeah.
But if that's where the history comes in. You
Right.
know, if
Having that relationship with them as well, right? Is this a client one who typically overreacts, or is this someone who is
Well, even if they give you a good history,
Right.
okay. Specifically, what do you think? Because if we see a happy, crazy animal, we're gonna be like, I think everything looks good.
right?
It was amazing how many office calls I didn't charge for because I'm like, your animal's fine.
Better safe than sorry, right?
Exactly.
This one's kind of a fun one. This is a would you rather question. Would you guys rather have a dog that can skateboard or a cat that can high five on command?
I would say the dog that can skateboard.
Right?
I think it's hilarious.
It's amazing.
Yeah.
I choose the cat that can high five because the dog that can skateboard, again, I'm thinking orthopedic nightmare. Like, what if they have a bad knee, bad hip, bad back, lower back, stuff like that? All those things come in.
I think it's more impressive to get a cat to high five,
That's true.
right?
I think cats
You think
will do
Stewie would high five?
it. Stewie does high five.
Oh, he does. Oh, mine.
Don't bring my personal life into
my
this.
my mistake. All right, I got 2 more questions for you guys. My dog and cat hate taking their medication. Any tricks to make it easier?
So it depends what kind of medication it is. I use a trick where you get a high value treat. And now that could be a pill pocket. It could be chicken and rice and make it into like a little meatball. So you give them one without anything in it. And and maybe even 2 without anything in it. And you're going to hide the pill in the third one and then follow it up with a couple more little pieces. So you're trying to hide that pill in the middle and see if that works. Most of the time it will. Now, sometimes they will still spit it out, and then you're stuck with, hey, do I need to learn how to pill my dog or cat?
But why does that trick work with that meatball is because dogs usually tend to chew the first couple, and then they just start swallowing whole.
It's a free-for-all after that.
Yeah, exactly. So that's a great trick to give the people. Pill pockets are incredible.
Great.
Do not get the duck-flavored pill pockets. They smell
horrible.
horrible.
I think the cheese ones smell really bad too.
Yeah,
I mean, they work great.
But I mean, pill pockets are great treats in general.
Yeah.
My dogs love them.
Yeah.
And for cats, I love churro.
Yes.
And they tend to love it too.
Yeah.
So you can mix a lot of things with churro.
Something I do a lot of training with my dog. So I just will start like fake training her. And then just one of the treats will be one with medication. So she's not even expecting, like, I'm not creeping her over to her in that weird stance of like, oh, come here, I'm going to try to pill you. Yeah. I'm like, oh, hey, let's do some tricks. And then by the time she's on her third or fourth trick,
Is your dog always on medication? Because you're always training.
Yeah, I mean, she's a French bulldog. She's,
there you go.
She's
You
always
had the
broken.
Frenchie.
She's
There's
always
the
broken.
Frenchie.
There's always something wrong with her.
But she is a Frenchie with an open airway.
She is. You fixed it for me. We'll have to get into that sometime.
Yes.
Last question. What's the funniest or weirdest thing a pet has done in your clinic?
Gosh. I'm trying to think. I can't think of something right now. Do you wanna take it first?
Man, I have so many. I mean, because I've been blessed, right? But I remember this one clear as day. This lady came in. She's like, my dog's not acting right. There's something wrong. And then literally it pooped out its daughter. She had a toddler, the T-shirt.
Oh, wow.
The dog had swallowed the toddler's T-shirt.
Wow.
And in the middle of the exam, I'm looking at it. All of a sudden, the dog postures to defecate. And boom, there's her daughter's T-shirt. And I'm like, oh, you missing this? And the funniest thing was, I put it in a plastic bag, and I go, here, you can just take it home and wash it. You're like, oh, I didn't really want to go for that one.
She was like, no.
No, that's okay. But that was the craziest one I've had. Other crazy, there aren't. Dogs and cats are amazing birds, rabbits. Yeah. They've done so many things. I love when they just come in and go through their routine of tricks.
Yeah. Yeah, they're like, I will do anything to just get out of here. Just don't touch me. I will sit, I will lay, I will shake.
Do all the tricks. Yeah.
Watch me spin. I can walk myself.
Yeah.
I had one that we really liked. Remember a dog that ate a giant diamond earring? It was like 1 or 2 carat diamond earring. And she was like, I've been searching my house and vacuuming and everything. And sure enough, we took an x-ray and there was just massive diamond earring. And she's like, well, I guess I know what I'm going through over the night. And it was 2 or 3 days later. She's like, got it. We were like, oh.
Well, I quoted her $35,000 for surgery because I figured the earring was worth at least twice that.
I would say one of the things I thought of is a dog that came in because it was gassy. And every 2 seconds, this dog would be farting and interrupting us talking. And we were just cracking up the whole time.
Did he have the guilty look on his face when he did it?
Yeah, but you got to be careful. Dogs that are gassy, it can bloat. Those are the ones that tend to bloat. So just... And not then on the spot, not because they have gas, but in the future, that's a problem that you got to be careful for.
All right. Well, I think that's it for today on these questions. Is there anything you guys want to add to anything?
No, thank you. Thank you for listening.
Yes.
Thank you.
Thank you for joining us
Sarah,
today.
thank you.
Yes, thank you for having me.
Thank you, Dr. Sarah and Dr. G.
And remember, please keep sending us your questions. We want to ask them. We're going to try to get to as many of them as possible. And thank you.